more statistics and more this and more that. But let me start by saying that I'm an immigrant. I came here when I was 8 years old, and nobody asked my opinion. Nobody said, where shall we go? And here I am. And so throughout my life, I've had, you know, one trauma after another. And I can understand thoroughly the trauma journeys. I've also had, as long as I can remember, anxiety. I used to think that in youth, as a young 10, 12, 13-year-old, I can tell the future. Because when my stomach is upset and it's going every which way, that tells me something's going to happen. Something bad's going to happen. Silly me, I can tell the future. But let me start off by starting on a lighter note. And throughout the presentation, let's use some laughter, because laughter is also very, very important to our day-to-day life. There's these two guys. I'm not good at jokes now, so bear with me. Just laugh on the punchlines. There's these two guys driving around, drunk, driving around, and all of a sudden they see police patrol coming up. And the one guy says to the other, hurry up, put those beer bottles away, but peel the label off the beer bottle. Okay, the guy did that. And put it on your forehead. And so the police officer stops him and says, can I see your driver's license? Oh, sure, officer, something wrong? Well, you haven't been driving very well. Have you been drinking? No, 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 no. You sure you haven't been drinking? No, 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 no. So what's those beer bottle patches, or the beer labels on your forehead? So, we're alcoholics, and we're on the cure, and that's our patch. I've had family members who have had addictions. And 20 years ago, when I was looking for resources, I ended up having to go out of province, because Manitoba, our Manitoba, was a wasteland, an absolute wasteland. And at that time I said, wow, you know, we need something here. I had done other projects in the past, and I thought, this is a slam dunk. Because who isn't suffering? What family isn't suffering? And I thought, well, I'll leave my career and I'll do this for about 3 years. Gave myself a 3-year timeline, having been experienced in other projects. I thought I was being realistic. And 19 years later, I'm still at it. And 19 years later, we're no further ahead in what we're doing. So I'm gonna, we have such a dysfunctional system. I need to talk over somebody else. We have such a dysfunctional system. And within our province, our recovery rate, our rehab rate, our success rate, what should be our rate is our failure rate. And we're at an 80% failure rate in our province. That was the same statistic that I learned about 20 years ago. Is it getting better? Frustration on my part on how can we improve it? Like I said, I thought I was only leaving my business side for 3 years and then gonna go back to it. And at that time, I went to each and every agency, because I'm a big believer in partnerships. Each and every agency saying, you know, we gotta do this and we gotta do that, and you have your mandate for this, and I'm gonna set up this one, because I was no different than everybody else, wanting and meaning and trying to do well and setting up another agency, yet another agency in the hundreds that are out there, and meaning well. And we can interact against each other, and somebody comes into my agency and I know that it's not right for them, I'll transfer them to you, and you do that way, and I'm going on and on and on and on. And I can hear to this day, I look back and I say, oh, was I an idiot? To this day, I can look back and say, and I quote, I'm sure some of them said that, who the hell's that bitch? She's not from our industry, she's not trained, she doesn't know what the heck she's saying. Who is that? 20 years ago, no one was talking mental health. 20 years ago, no one was talking underlying disorders. 20 years ago, to this day, we still have a patchwork. We still have where mental health is on this side, addiction is on this side, and when do we start doing this? When do we start thoroughly, 100% doing this? I can tell you honestly, having now worked in this industry for 19 years, and it is an industry, it's a big dollar industry. Don't any of us let us kid ourselves. It's a big dollar industry, all North America, big bucks. So whose incentive is to amalgamate, communicate, work together? Not at the top level. I can tell you honestly that every addiction that is out there is 100% co-occurring. 100%. It was never, ever, ever the first that walked through the door. Ever. Ever. Something opened that door. Was it because we were born with it, that we were born with anxiety, that we were born with bipolar, that we were born with borderline, we were born with FASD, we were born with meth disorder, where the most heart-wrenching is seeing a baby born already going through withdrawals. So were we born with any of it? Again, the addiction was not the first that walked in the door. Something else walked in the door. Every addiction has an underlying driver. Every addiction. What? The mental health side, they are right when they say, oh no, it's not 100% mental health and 100% addiction. Because not every bipolar, not every schizophrenic, not every borderline personality becomes addicted to a drug. So there's statistics I would agree with that are 30, 40% that have an addiction. Our day-to-day life has become, in the last 20 years, even more complicated, even more driven. But the stigmas are still there. We're starting to break down the stigmas. This is a fact. This does happen each and every day. Oh yeah, well the person's crazy, okay? Person's crazy. Just stay away from that person. No, the person has an illness, and let's help deal with that illness. In addiction, we don't yet understand it. We're starting to understand it. We're starting to talk about addiction and mental health together. But let me ask every one of you, and you're the ones that know it better than the statisticians, better than the ones that are doing all the studies and putting out these journals, medical journals, giving 30% and 13%. You're on the front lines. You see it every day. Every day we are working with people that each and every one of them has underlying causes. You can teach the scientists, the researchers, a lot more from your day-to-day experience than they could ever get by doing a 300-person study or a 500-person study. So we do at the front lines understand it. We just aren't getting the tools. Let's talk about our province again. The Virgo report, which has been mentioned a couple of times this week here, has truly proven what I was saying 20 years ago in my uneducated way. And that is that this whole system in our province is dysfunctional. It is so disjointed. It is so non-communicative to each other. Is it done on purpose? Honestly, I have to say to each one of you, no. Because each agency out there, like me, when I started the first agency 20 years ago, means well and wants to do the best job that they can for their people. But like I said before, now I added one more agency to hundreds that are out there. I've personally added two, not one, but two. So let's start from when the world started saying. The World Health Organization states that in 1950, I was 2 years old, in 1950, it stated that addiction is an illness. However, our Canadian universal health care really begs to differ. And it has begged to differ for the past, last 5 years, it started changing its dialogue. It has stated, no, it's not an illness. No, it's behavioral, it's moral, it's a weakness, it's this, it's that. So they'll detox you, give you a list of if they do that, a list of community resources and say, go for it, just go for it. So what has resulted since 1950 is a patchwork of all well-meaning out there across Canada. On the mental health side, it is termed an illness. We do have psych wards. We do have standalone psychiatric hospitals. Do we still treat it with the continuity that it deserves to be treated? No. Incarceration, over and over and over again, all the way through, it is also dysfunctional. Until we put it all in our universal health care and say it is an illness, they are both an illness, we haven't made that decision yet. The patchwork will exist. From the top down, it will exist. As the presenter from the Elizabeth Fry Society stated, and that was, until the population goes up into a hue and cry, they're not going to change things. The political will not be there. It's a reactive, not a proactive. So we still have blame, shame, embarrassment, punishment, so punitive. We still have all of that in our day-to-day lives. We still have all of that even in our own, because it is such an acute illness. Mental health and addiction is such an acute illness that there's an ugly side to it. We all have somebody we know. Everyone in this room has somebody that we know. When did we, being the non-addictive, when did we start becoming frustrated? When did we start being argumentative? When did we start saying, that's it, I can't take anymore, out you go. Because we have gone beyond our coping skills. And the reason being is that we don't have resources that we can readily go to by saying, just a moment, I have a heart condition, I'm gonna go to the St. Boniface Hospital, to my heart specialist, and then be taken to the St. Boniface Hospital. Oh, just a moment. I have lung cancer. Oh, just a moment. I have diabetes. We have areas that we can go to when we actually have illnesses. Since 1950, why are we surprised today? Since 1950, because addiction and all the underlying causes have never really been recognized by our government as an illness, then we, all of us, whether we're trauma-driven or where we have an actual underlying anxiety, depression, bipolar, schizophrenic, where we didn't find the resources, then we had to become physicians heal thyself. And when we became physicians heal ourselves, what did we have available to us to help cope? What did we have available to us? Oops, we had drugs, we had alcohol, we had behavioral addictions. We had to start finding medications to be able to cope with what we were going through minute by minute, day by day, where the anxiety is so bad that your chest constricts because you can't breathe, or your depression is so bad that you just can't get out of bed. Or in most cases, when there always are childhood underlying causes, when does it usually start to exhibit itself? The past, it's usually been around 12, 13, 14 years old, where availability and capacity happens. And they're hanging around with their friends, they're having that first bottle of beer or that first whatever. Okay. The teenage years are experimental years. They are years of let's try this, and so many continue into their adulthood and move away from all of that. But the ones with the underlying causes and the underlying disorders that have overtaken them, those are the ones that we deal with them as young adults, and over and over and over again as they grow in age. And so few are able to have that lasting rehabilitation. What's been our go-to in North America? In the United States, as I said earlier, addiction is big business. In the United States, in 1997, I don't know the current statistic, but in 1997, addiction, private and public, was a $30 billion industry. Why is anybody going to try and dismantle it? It's big bucks. Governments make money, banks make money, agencies make money in the States. 80% of those agencies, again, private and public, the standard go-to is still, and I am going to say it because some people will get offended, but it's the truth. It's so publicized. It's still a 12-step program. That has a 12, 13, 15, maybe 20% success rate. So I have breast cancer, and I go to the doctor and I say, what's my, well, you can have this treatment, and we may add this and we may add that. Would you and I accept that? But you only have a 20% success rate. 80% of you are going to die. Would we accept that? The 12-step program was never designed to be a cure. Never. It was designed to be a fellowship. Let's treat it as a fellowship. Let's look at the person and say, will that work for you? Will that fear-based, stringent program work for you? Or do you need something else? Do you need the mood disorder peer support program? Do you need the Schizophrenic Society other peer support program? Do you need the SOS group? Do you need the refuge? What is going to work for you? What's going to work for you? If you learn how to knit booties, will that work for you? Okay, let's go to the corner, let's learn how to knit booties, because that's what's going to work for you. 20 years ago, I learned, because I didn't come from this industry, I didn't know how to stay in this box. 20 years ago, when I was looking for family members, and I'm Italian, I said I'm an immigrant, I'm Italian. And so my husband was saying to me, look in Italy, because we can take them there. Well, Europe is way ahead of us. 20 years ago, I found St. Pat. And you're like, well, I couldn't convince anybody to go there. I'd go there in a heartbeat because it is phenomenally beautiful. St. Pat is the largest treatment facility, and I use the word treatment because it is an illness. We can use treatment, we can use rehab, but we gotta start with treatment. Then, just like a heart condition, you operate and then you continue to rehab. So, it is the largest center in Europe. At any one time, it has anywhere from 1,200 to 1,400 clients. Their success rate, independently verified by various universities over the years, is anywhere from 85 to 90% long term. San Patrignano. S-A-N, spell it, S-A-N-P-A-T-R-I-G-N-A-N-O. It is termed as an NGO, non-governmental organization. We have similar ones here. We have BHF, Behavioral Health Foundation, set up similarly like an NGO, a community. You commit yourself to a 6-month to a year rehab. We have the John Volcan Academy in Surrey, BC, that I've referred people to. I will decline a person that comes to my door if it's not going to work for them. I'm not going to take your money. And I've referred a 19 and 20-year-old to the John Volcan Academy, where you sign up for a year. St. Pat, and that's where I learned it, not because I'm super intelligent and I did my research, but St. Pat taught me 20 years ago, you work with the person, not with what they're medicating, not with what they're using. Figure out the person. St. Pat has 50 to 60, I think 60 some odd businesses on the property, first-class businesses on the property. They are totally run by the recovering clients, totally, from the front door to the back door. They learn how to. If you want to purchase a Olympic jumping horse, I don't know the term, the proper term, equestrian jumping horse, if you have 250,000 euros to throw away, you go and buy one of theirs. And then you're going to be competing with that horse. So they have proven that there's 2 types of clients that go to St. Pat, the ones that go there voluntarily and the ones that go there court mandated. You commit to a year. Their success rate on both is the same. So what they've proven is that it doesn't matter how you get that person to the trough, it's what you do with that person once that person is at the trough. Does not matter. This North American phenomena that we again have is that, oh, you gotta hit bottom, No, we now know that there's